like to introduce another champion of our movement, Marcia Greenberger, chair of the National Women's Law Center. Please welcome.
This is so terrific. I can't tell you how all of us are beaming and we are brimming with energy and fight. And we just can't wait to go and see all those meetings that you're going to have and find out what it is you're going to be reporting to us. And we know that you're going to make all the difference. Well, we all heard a simple promise, a promise that we believe in, that we stand for, that health reform, which we need and we want, would not force people to lose the coverage they currently have. People is not just men. Is precisely what would happen if the anti-choice members of Congress have their way. Millions of women would lose coverage for abortion that they currently have. The National Women's Law Center started a campaign. Being a woman is not a pre-existing condition. And we've been fighting and mobilizing with you and so many of your sisters and brothers all over the country to end the disparities that women face in the healthcare system, and healthcare reform can mean that women will no longer be charged more than men for insurance. Or be denied coverage for having that C-section, or for being a victim of rape, or the list goes on and on and on. But make no mistake about it. It is totally unacceptable to tell women that what reform gives with one hand, it takes away with another. Even without Stupak, the reform bills already contain a painful compromise, as we know. And it accepts the unfair status quo that no federal funding will cover abortions except in the cases of rape, incest, or to save the life of the woman. But the Stupak Amendment takes the concept of no federal funding to ridiculous extremes, forbidding literally millions of women from using their own money to buy abortion coverage, and that is not fair, that is not right, and that is not safe. We read in the news just yesterday about a 41-year-old government employee who's living under the regime we now have, and she was charged thousands of dollars to terminate a wanted pregnancy that her doctor determined was a serious risk to her health because the fetus had a lethal fetal anomaly. She was given a bill of $9,000. She negotiated it down as a lawyer to just $5,000, believe it or not. The Stupak Amendment would put millions more women who currently have coverage for just such emergencies at grave risk. We will not stand for it. We will not trade away women's rights or allow women's health to be used as a political pawn, and we will prevail. Thank you all so much for your hard work, for your determination, and we will prevail.
Thank you, Marcia.